Okay, let's start recording. Has it started recording your side? Has it started recording your side, Andrea?
Pardon?
Has it started recording your side?
No,
on Teams, sorry. Oh, you might not be able to see Teams because you're sharing. Don't worry, it's recording. Cool. If you go back to the first slide, I'll start.
Yeah. Okay.
Good afternoon, everyone, and thank you for joining us for this 30-minute session on ISO 14155. Today, we will be looking at ISO 145-2020 and study initiation visits. Andrew and I will cover sponsor and investigator responsibilities, informed consent, good documentation practice, and source document verification. We have had a few pre-submitted questions, but please do feel free to add questions to the comments function and we will review them all. We will follow on from this webinar with a second part in a couple of weeks that will focus on the GDPR and SAE reporting for clinical investigations. So if you go to the next slide, please, Andrea. So my name is Camilla Fleetcroft, and I'm the Vice President for Clinical and Regulatory Affairs at ECLVAR UK. I have a background as a regulator. I spent nearly 9 years with the MHRA in the UK, firstly as their clinical advisor, then working as head of clinical investigations and evaluation, then moving on to their group manager for devices regulatory affairs, which subsequently became deputy director for innovative devices. I have a huge experience across EU regulations and UK, both current and future regulations. I also have some previous notified body experience with SGS in the UK. I will hand over to Andrea to introduce herself.
Hello, my name is Andrea Offer. I'm the Senior Principal Project Manager at ECLVAR. My background is 10 years of experience in clinical operations and clinical regulatory in the field of medical devices for various indications and therapeutic areas, clinical strategies, regulatory, conducting global clinical investigations, and leading full functional, cross-functional global teams. I have experience in preparation of submissions for approval to higher federal authorities and ethics committees, and of course to the BFS in Germany. And I also have 2 years of experience as a CRA manager for the EU, involved in planning, directing, coordinating activities of the clinical department. I hand over to Camilla again.
Thank you, Andrew. So if we could go to the next slide. Thank you. So as I've already mentioned, we're going to cover a few aspects today. So sponsor responsibilities, investigator responsibilities, the informed consent process, good documentation and source documents and medical records. Move on to the next slide, please. So firstly, what is ISO 14155-2020? If we could go to the next slide, please, Andrea. So ISO 14155 is the standard for the clinical investigation of medical devices with human subjects. It's the good clinical practice standard. And it has been around for a number of years. It's considered the gold standard for the conduct of clinical investigations. And in 2020, we received an updated version building on the 2016 publication. We are going to highlight some of the key principles and points to note around the use of ISO 14155, critically that it is in line with most current regulations. It is a harmonised standard for the EU MDR 2017-745. It also aligns with other global regulatory principles and aligns with ICH E6 on GCP. The standard does have a focus on sort of operational ethical aspects. It is not a strict regulatory standard. And neither does it cover the specific procedures within specific regulatory jurisdictions. For example, as you can see, the coordinated assessment under the MDR. But it does allow those using it and are compliant with it to achieve a good standard for planning, conduct and closure of a clinical investigation. Critically, a point to note is data generated from an investigation conducted in compliance with this standard is generally accepted in many countries, including the USA. Go to the next slide, please. Thank you. As I already alluded to, the data generated by an investigation designed and indeed compliant with ISO 14155 is widely accepted, and for investigator-initiated investigations, the data would be acceptable for the purpose of CE marking within the EU. The standard was developed and updated by no less than 99 experts, and these came from across 23 countries. The key updates will be covered at another time, but one point to note is the addition of Section 4, which provides the summary of the GCP principles, and this is new to this updated version. Historically, 14155 was used as a bit of a default guidance for IVD performance studies. However, with the publication in 2019 of ISO 29916, this now covers performance studies specifically and should now be the key reference moving forward. Next slide, please, Andrea. So with that little bit of context, we're just going to move on to some of the responsibilities. So starting with sponsor responsibilities, if we go to the next slide. They are clearly set out in Section 9 of the standard and do cover a range of factors, and I really encourage you to have a look at this in detail, but this is just to pull out the relevant sections and some key points. This section does include clinical quality management. It sets out planning and conduct considerations, so your selection and training of clinical personnel, preparation of your documents, indeed the conduct of the clinical investigation itself. Really importantly, it focuses on monitoring, the safety evaluation and reporting, and closing out the clinical investigation is also covered. Other points covered within the standard to note are outsourcing of duties and functions and communications with regulatory authorities. We can move on, Andrea. One point we wanted to pull out specifically is Section 924. And this really focuses on that monitoring aspect and the critical factors that are really important for sites to be aware of. Sponsors must ensure that the site personnel do have the support they need and that they have their questions answered. Once enrolment has begun, there does need to be monitoring and awareness of some key points. Firstly, the informed consent procedure, ensuring that it is being conducted appropriately. The enrolment rate for that particular site, ensuring that the protocol is being adhered to as intended. That ECRF data is quality reviewed and verified. That the investigator site file should be monitored to ensure that it's up to date and all the logs are being completed. Safety reporting is obviously very important. And finally, the investigation device. So handling in terms of deliveries, orders, and the returns that have occurred. It is important to note that audits can, of course, be completed to check this compliance. And this is the monitoring process is really done through a few steps. You have the site initiation visit, and this is really critical at setting that baseline, making sure the sites have received and have understood the requirements, that they have access to the required devices in the numbers they need, and really critically that they have been trained on the device being investigated. Sponsors can also use routine monitoring visits, and these should be conducted to ensure the requirements and conduct remain appropriate and in line with the prepared documentation. And also, finally, monitoring can be further conducted through the closeout activities of that investigation. Just to note, a requirement that monitoring reports should be documented, and within these reports there really should be sufficient detail to support the demonstration of compliance with the original monitoring plan. Next slide, please, Andrea. One final point I want to cover just before I hand over is around the registration of clinical investigations, particularly on clinicaltrials.gov. So section 5.4 states that clinical investigations shall be registered in a publicly accessible database before the start of recruitment activities, and the content shall be updated throughout the conduct of the clinical investigation, and indeed that the results entered at the completion should be entered at the completion of the investigation. It's important to note it's also a requirement of the FDA that clinical investigations are registered, and the EU MDR also has registering of clinical investigations as a requirement. Although important to note for the EU, EUDAMED and its clinical investigation module is delayed. So without the fully functional EUDAMED, sponsors can wait and register the trial retrospectively. However, they can choose to do it proactively at the beginning. I think it's important to note that a lot of member states do actually require this within their own national requirements. So most sponsors do. You can choose to register it technically in a few things. So the World Health Organization's International Clinical Trials Registry platform, the European Trial Register, or clinicaltrials.gov. Clinicaltrials.gov is a really useful tool. It's worldwide, it's open, and it's a public database. This allows participating sites to be searchable and visible on that database so the public can see what is occurring. And it is, like I said, whilst not officially mandatory, it is expected by most member states. So something to bear in mind as you set up your trial. I will now hand over to Andrea to go through further aspects.
Thank you, Camilla. So I move on now with the investigator responsibilities in studies, which is a critical point when it comes to training of sites, so they are aware of their responsibilities. The sponsor cannot really remove their responsibility on the whole study, but they can delegate the site responsibility to the principal investigator. So Section 10 mentions the responsibility of the principal investigator. And so this is what needs to be considered is the qualification of the principal investigator, the qualification of the investigation sites, including the site team, the communication with the EC, if this is required to be done by the site, the informed consent process. This is something the sites need to be trained very thorough on. Compliance with the CIP, the medical care of subjects, and the safety reporting shall be discussed. The informed consent process is more detailed in Section 582, the process of obtaining informed consent. The key points of the informed consent process are provide information to the subjects, discuss options with the subject, answer questions to the subject, obtain signatures to document agreement, document the process in the medical records of the subject, retain originally signed informed consent form at the site and provide a copy of signed form to the subject, and it must be obtained from each subject prior to any investigation participation, including study-specific screening phase. So the next step, what sites need to be trained on, is the good documentation practice. So we have the ALCOA plus C from the ICH E6, and the ISO 14155 almost states the same. So the data shall be attributable. So thus the documentation clearly demonstrate the link to its source, who observed and recorded the information, when the data was observed and recorded. Is it legible? Can the information be easily understood? Is it recorded permanently on durable medium? Have original entries been preserved, so not obscured? Contemporaneous, was the information recorded within the timeline? Original? Is the source information accessible and preserved in its own form? Accurate? Does the recorded information describe the conduct of the study without error? Did the conduct of the study conform with the protocol? And who made corrections? And when corrections were made? In addition, we have the +C for complete. Does the documentation include all the necessary information? For the correction of data, clause 7A2, recording of data, provides a little bit more information from the ISO 14155/2020, how it shall be done and what is meant with this. The clause 9245 is the routine on-site monitoring visit, and it states appropriate corrections, additions of delegations are made to the CRF, dated, explained if necessary, and initialed by the principal investigator or by his or her authorized designee. The monitor shall not make corrections, additions, or deletions to the CRF. So, and you can see how the corrections should be done. So a very clear, dated and signed correction should be on all CRFs where corrections have been done. For source data verification and medical records, this is our next topic. So source data is the information in the original records. An example, for the age and gender, the source data is located in the medical records, but not in the ECRF. The monitor needs access to the medical records. This is very important that subjects are aware of it, and also the medical staff at the site, so that it is possible to do source data verification. With the updated version of 2020, the ISO 14155 was adjusted to also reflect the necessity to maintain documentation of type and location of the source documents for an investigation. The type and location of the source documents shall be documented on the source data location list if possible. These documents where source data is located, the medical records, ECRF, worksheet, or other, for each variable should be performed. The medical records, what study relevant information is required. So the informed consent process shall be documented adequately in the medical records. The minimum study related information in the medical records for subjects in investigation should be the subject code, the investigation code, the medical history, past and current as relevant, the treatment withdrawn or withheld due to the participation of the investigation, treatments given, including investigational products and any changes in treatment during the investigation, visits to the clinic and or home care visits during the investigation, including those for investigation purposes only, adverse event, serious adverse events, including adverse device effects, date and reason for completion. Required signatures for source documents. So this is always a question that comes up. Do we need to sign the printouts? Can a monitor have access to the electronic medical records? So in ISO 14155 in clause 7.8 for document and data control states traceability of documents and data. All documents and data shall be produced and maintained in a way that ensures reliability, integrity, control, and traceability. All documents and subsequent versions related to a clinical investigation shall be identifiable, traceable, and appropriately stored to provide a complete history of the clinical investigation. So, and all copies of the retained original source documents shall be certified as indicated by a dated signature of a member of the investigation site team. And in Annex E of the 14155, the list of, there is a list of essential documents, and this list of source data location shall be filed at each site investigational file. So this was it from me. I know it's quite some overview, and if you go to the ISO 14155, you get more information, but I wanted to link what could be discussed, and that it is so important for sites to know what responsibilities they have and how they could work best with a monitor. So, and yeah, so we will soon come with the part 2 of this webinar on GDPR and subject rights, safety reporting and corrective measures, and prevention of data breaches. So if you have any questions, you can put them in the comments, or you can write an email to Camilla and myself so we can come back to you with answers. Thank you.
Thanks, Andrea. We do have a couple of pre-submitted questions, so if it's all right with you, I will pop you on the spot and ask you a couple of them. So the first question we have is it possible to enter data directly into the CRF without double documentation?
Yes, of course. For ICH GCP R2, it is in 6.4 trial design that identification of any data to be recorded directly in the CRF and are to be considered source data. The ISO 14155 also states recording of data. The CIP shall specify which data can be recorded directly into the eCRF. So this means the monitoring plan is also possible to document, but this means it might not be possible to SDV because we do not have another source, but then at least a data review can be noted for the monitor. But it is possible, but it should be outlined in the protocol, the CIP, or the monitoring plan.
Thank you. And just one last question is, when a site cannot grant access to the electronic medical records and only provides printouts, do these need to be signed? I know you touched on signatures a lot, but do these ones need to be signed?
Yeah, so the 7.8 document and data control and traceability of documents and data states where relevant, the accuracy of translations shall be guaranteed and documented, and it shall be certified as indicated by a dated signature by a member of the investigation site team. So it might be the study nurse, the principal investigator, the sub-investigator. So, but it needs to be signed, and then it is a certified copy.
That's great. Thank you, Andrea. I think that's all the questions we have. So I think it's hopefully it's been a really useful session. It's been high level with some really key focus. But as Andrea said, if you do have any further questions, do put them in the comments or email us directly. We will be collating and reviewing all the comments, and we will provide a response to those who signed up to the session. But yes, so thank you very much for joining. We really appreciate your support, and we look forward to seeing you at part 2 of this training module. Thank you.
Thank you.